Hello everyone, I'm Dr. Kraus. The rising costs of healthcare are affecting everyone. As a healthcare provider, I see this not only from the perspective of the physician, but also from the side of the patient, as I and my family are patients at times as well, and we have to buy health insurance coverage as well. We all know that healthcare costs are rising, but how can we afford to keep the care that we want, the doctors that we want, and still afford to pay the premiums? The good news is that the federal government has implemented plans and policies which will help any individual in the United States to better afford the healthcare coverage which they choose. It is up to each of us to learn more about these policies and how they can help each of us and our families. Let HSA be your friend. Health insurance plans are changing. Premiums are increasing, deductibles are going up, maximum out-of-pocket costs are rising. That's a fact, and the more educated patients become about the various plan options and about government laws regarding health insurance, the better off they will be. Over the past several years, terms like high deductible have become more common. But along with that, the term HSA, or Health Savings Account, has also become more widely understood. There are several federally endorsed plans which are meant to help patients to better afford health care. The federal government of the United States has implemented these plans in order to help the people of the United States to be able to make health care more affordable for themselves and their families. It is important for each of us to take advantage of all the help which our government is trying to give us. The terminology of healthcare insurance is important to understand. In order to better navigate the healthcare system and determine what's best for each of us, we must understand some basic terminology in healthcare insurance. In order to begin, we have to understand some basic terminology regarding healthcare insurance. The word premium. This refers to the amount of money which a person must pay in order to obtain an insurance policy. It might be paid monthly, quarterly, or semi-annually, or annually. The word deductible. This refers to the amount of money which an insured person must pay before an insurance company starts to pay money for their claim. The word copay. Copay refers to the amount of money which a person must pay for a claim in addition to the amount that the insurance already pays. Maximum pocket. This is the amount of money which a person will have to pay before the insurance company pays 100% of the payments to the provider. After this, the patient is completely protected from additional payments to the healthcare provider. As we enter the changing world of healthcare insurance and high-deductible plans, otherwise known as HD/HP plans, it is critical for patients to understand policies which the United States government has implemented to help protect those living in the United States. As deductibles and maximum out-of-pocket expenses are increasing with high-deductible health plans, it is important for patients to understand Health Savings Account, known as HSA, Flexible Savings Arrangements, known as FSA, and Health Reimbursement Arrangements, known as HRA. Without the full and proper understanding of these, patients might not be aware of how to continue to receive excellent health care at an affordable price. In order for patients to receive the best health care possible, they must be well versed in the arrangements which the federal government has set in place to help and protect them. High-deductible plans are increasing in popularity due to the appeal of lower premium costs. Initially, the high-deductible plans were felt to have lowered costs as far as the patient premiums were concerned. The reality of these coverages occurred when it came time for patients to use the plans. Then, significant costs were incurred as patients had to often meet high deductibles before the benefits of the plans kicked in. Patients must understand how to utilize the opportunities of HSA, FSA, and HRA accounts to counteract this and make the high deductibles and high maximum out-of-pocket expenses affordable. The good news is that the federal government has implemented several programs to help protect patients, and shield them from some of the rising costs of healthcare. The three programs which will be discussed here are: number 1, Health Savings Accounts, HSA; number 2, Health Reimbursements Accounts, HRA; and number 3, Flexible Spending Accounts, FSA. Please visit the government website shown at the irs.gov location in order to see further information about these plans. Health Savings Accounts, HSA. According to the federal government, a health savings account is a tax-exempt trust or custodial account which an employee can set up with a qualified HSA trustee to pay or reimburse certain medical expenses which they occur. The contributions remain in the employee's account until they are used, and the interest or other earnings on the assets in the account are tax-free. The HSA is portable and remains with the employee if they change employers or leave the workforce. To qualify for an HSA, an employee must be covered under a high-deductible health plan. For 2015, the definition for an individual was a minimum annual deductible of $1,300, up to a maximum annual deductible and out-of-pocket expense of $6,450. For a family, these numbers increased to $2,600 and $12,900 respectively. In 2015, the maximum contribution for individuals was $3,350 and $12,900 for families. Employees can receive tax-free distributions from their HSA to pay or be reimbursed for qualified medical expenses. It is not necessary to make distributions from the HSA each year, and the money, which is in the HSA of the employee, remains with that employee. Qualified medical expenses which are covered by the HSA are those expenses which would generally qualify for medical and dental expenses deduction. Medications are considered a qualified medical expense if it requires a prescription, or in the case of an over-the-counter medicine, the employee receives a prescription for it. Flexible Spending Arrangement, FSA. A Health Flexible Spending Arrangement, FSA, is a program which allows employees to be reimbursed for medical expenses. They are typically funded through voluntary salary deductions, which are arranged with the employer. Contributions made to an FSA by an employer can be excluded from the employee's gross income. There are no employment or federal income taxes deducted from the contributions. Employees can withdraw funds from the account to pay qualified medical expenses, even if funds have not been placed in the account. Health FSAs are employer-established benefit plans and may be offered with other employer-provided benefits as a part of a cafeteria plan. For plans beginning after December 31, 2012, salary reductions contributions to an FSA cannot exceed $2,500 per year, or a lower amount if set by the plan. Money in the FSA is not used by the end of the year is forfeited. Distributions from an FSA must be paid to reimburse for qualified medical expenses. An employee is entitled to receive the maximum amount of reimbursement at any time during a coverage period, regardless of the amount which has already been contributed. Payment might be made with credit cards, debit cards, and stored value cards given by the employer. Health Reimbursement Arrangement, HRA. A health reimbursement arrangement, HRA, is funded solely by an employer and cannot be paid through a voluntary salary reduction agreement on part of the employee. With an HRA, employees are reimbursed tax-free for qualified medical expenses up to a maximum amount for the coverage period. Any unused amounts in the HRA can be carried forward to reimbursement in future years. There is no limit on the amount of money an employer can contribute to the HRA. Payments for qualified medical expenses are often made with debit cards, credit cards, and stored value cards. I hope this helps to answer how we can solve some of the problems with increasing health insurance premiums and yet still afford to keep our doctors, keep excellent care, and make healthcare affordable. Please subscribe to our YouTube channel to be updated about any future healthcare topics which we're discussing. Thank you very much for listening. If you would like to have a question answered by Dr. Kraus, just complete the form at www.spinehealth.com/contact-us.php. In the contact form, you'll notice a box requesting insurance. In this box, just simply type Ask Dr. Kraus. Thank you very much for listening, and we look forward to seeing you soon next time.